Hey Jackie, thank you so much for joining the channel. I'm really looking forward to this interview. And would you like to start by introducing yourself?
Okay, my name is Jackie Nelson Walburn at Real Health Solutions, solns.com. And I specialize in the over 40 crowd with chronic conditions to help reverse or remiss those chronic conditions for people, as I myself had to do it for myself to learn all the ins and outs. So I have walked the walk, not just talking the talk. So it makes me more of an expert, I think, than other people. And this is basically, I want to share with people because they don't understand therapeutic diets. They know fad diets, but they don't know therapeutic, where nutritionists, dietitians can actually lead you on a path to dietary changes that will change your health and reverse some of your conditions, not usually in isolation, but um, with other supplements, herbals, botanicals, even drugs, depending on where you are, everything from diabetes to cancer to arthritis, it's all in the diet.
So, what types of diets do you tend to recommend to patients?
Well, I am actually a paleo keto coach. Those are the ones that I am the most versed in because that's what I had to do for myself. And so I had to
Mhm.
learn all the ins and outs. I have over 1,000 recipes on my Pinterest page. Feel free to go and get them. But because I had to do all this for myself, I had to learn that particular diet worked out best for me to do a paleo keto combination. I didn't have any autoimmune conditions, so AIP wasn't appropriate. And I tried vegetarian vegan diet and I was hangry all the time. So I stick with the ones that I am the most versed in, but we'll go through all of them here so that people can
Yeah.
decide what they think is the best diet for themselves, or what to ask their dietitian, nutritionist, doctor. No, well, doctors aren't going to be very helpful, but you can ask them which one they think, based on their diagnoses, which is going to be the best therapeutic diet for them. But
Mhm.
anyway, so starting with the little paper I gave you here, this is a pros and cons of the major healing diets. And you have to make a decision or have a nutritionist or a dietitian, not really dietitian, mostly nutritionist, help you decide which one is the best one for you, because there are ones that overlap depending on any other diagnoses you have. The number one that most people have heard of is the Mediterranean diet. And the
Mhm.
problem with the Mediterranean diet is it doesn't actually on its own help reduce or remiss or reverse any chronic conditions. It's a great maintenance diet for health. And if you wanted to get off some of the other foods you're eating to get a little more healthy, that's it. That's all you want to do. Mediterranean is great, but it's really hard to do in the United States because it requires all heirloom flowers, heirloom foods, nothing GMO, nothing sprayed with glyphosate, nothing everything. Europe refuses any of our food because it's so polluted and contaminated. That's how different it is. So Mediterranean's hard to do here, but can be done. You just have to make sure you buy nothing but Greek and Spanish type foods at the store that say that's where they originate from. You check the ingredient list, make sure they're all organic. But anyway, I don't usually work with the Mediterranean people. That's something that I can recommend to them if after when they reach their goals on reversing anything else. Now, the number one that I'm going to be talking about here, we're going to start with the paleo diet, which is also called the caveman diet. And the goal here is to break the habit of living on empty calories, junk food, pastas, pastries, beet sugar addiction, all that kind of stuff is the reason for this one. It's best for you if you want to see if food can reduce your or reverse your health conditions like heart disease and arthritis and weight loss. What you can do here is organic meats, fish, nutrient dense vegetables, fruits, nuts, seeds. I have a nice little chart here. This is the food pyramid turned upside down, basically, from what I learned in my dietetics program,
Mhm.
where you have mostly fruits and vegetables on the bottom, supplemented by your your different types of proteins, and then your berries, your seeds, your oils, your safe starches, and fruits are all towards the top to be minimalized in your diet because they all cause different kinds of problems if you get too much of them. What you can't have on a paleo is all grains. That's wheat, rye, barley, oats, corn, rice. Are all removed, basically. Um, all dairy. I had an issue with dairy, and whey protein was giving me problems, so I had to get rid of that too. Alcohol, additives, and all forms of sugar. There's over 100 names for sugar. So they try to hide it from you on the ingredient list of what it actually is. So got to be careful
Yeah.
of that. So basically, if you're not making it, you probably shouldn't eat it. Difficulties is it's really intense for 5 to 7 days to kick carbs and sugar. After that, it's pretty easy as your gut flora, your microbiome adjusts because you have die-off issues for all the sugar craving foods and the junk foods that the bacteria in your gut have accumulated and are controlling you and sending cravings to your brain. And so for 5 to 7 days, they're going to die and you're going to have symptoms. They call it the keto flu, basically. But anyway, it's if you do lots of coconut oil and you do electrolytes, you can, it really isn't, aren't any symptoms. And you don't have to go all in at once either. The benefits is many see dramatic results in 30 days, break the habit of eating highly processed foods, even healthy junk foods, such as gluten-free baked goods. They're no good. Fruit, yogurt, no, that's mostly sugar, believe it or not. And there's others that you'll figure out along the way.